Knock, knock, Mrs. Jones. My name's Madison, and I'm going to be your student nurse today. We just finished up doing suctioning not too long ago, and now I'm going to clean your trach up and get you all cleaned up and feeling better, okay? So before I begin, I'm going to check and make sure that his name and date of birth is correct. Mr. Jones, can you tell me your name and your date of birth? Perfect, thank you. I'm going to assess his lung sounds to make sure that they still sound clear from suctioning. I'm going to do an overall assessment. I'm going to make sure that my patient is still in the semi-Fowler position. I'm going to do vital signs, oxygen, make sure his oxygen level is within normal range, heart sounds, lung sounds, all of that as well. Okay. My patient was previously hyperoxygenated when doing the suctioning, but his oxygen levels have been turned back down to normal. Okay, Mr. Jones, if you need anything, if you are not tolerating this procedure well, just be sure to raise your left hand, okay? Perfect. And there is an extra trach and obturator at the bedside at all times. When doing this, I'm going to be mindful of my margins. To remove everything that I'm going to need. Again, being mindful of my margins. Okay, so at this time, I'm going to fill the 3 components with solution. This is just a sterile, normal saline solution. And then this is the hydrogen peroxide that I'm going to put into here. And now I'm ready to take the trach out. What I'm going to do is this is going to be my dirty hand, and I'm going to use this as my dominant, clean, sterile hand. I'm going to take the trach out. And I'm going to put it in the solution with the 50-50 hydrogen peroxide and the normal saline. I'm going to let that set for a little bit. And then I'm going to clean the trach over the trash can because I do not want to get any of the remnants on the sterile field. Now I'm going to drop this into the normal saline solution and let that set for a little bit. And I'm going to pick it up with my sterile hand. I'm going to tap it, making sure not to get anything on my sterile field. I'm going to place it back in its place, and I'm going to place it until I hear that clicking noise. Okay? And now I'm just going to clean around the area. I'm going to use the solution that I have not used at this yet, just to kind of clean around the area, making sure to get all of that mucus and any secretions cleaned around there. I'm going to make sure to dry it very good. And at this time, I'm going to place the new trach tie. Mr. Jones, are you doing okay? Perfect. There is no redness or anything in his secretions around his trach. All looked good. Nothing alarming, no pus or anything. When doing this, I'm going to be sure to look around his neck and look for any breakdown, any redness, and be sure to document that if I see any. And I'm going to remove the old trach collar. Making sure to hold this trach in place while doing so. And then I'm going to make sure to tighten it. I want to make sure that I can stick, it's not too tight. I want to be able to stick 2 fingers still down in between there, making sure that it is tight enough, but like I said, not too tight. We don't want any skin breakdown. Okay, and at this time, I would now don off these sterile gloves and put on new sterile gloves to place the padding under. For video purposes, I'm going to keep these sterile gloves on, pretend like I donned and put new sterile gloves on. Also in between, I would do hand hygiene. And I'm going to take my sterile gloves and I'm going to place his new pad up underneath of his trach. Okay. I want to make sure that there are no creases or crinkles. We don't want any extra skin breakdown. Now I would place the oxygen back on Mr. Jones. Mr. Jones, you did a great job. Is there anything else we can do for you? Perfect. At this time, I make sure to lower his bed back into its position. I make sure that Mr. Jones's lung sounds were clear still. I would do an overall generalized assessment one more time to make sure that he's comfortable, he's breathing well, his oxygen is back in place, and that is all.